Hello everyone, my name is Elliot Elliott, and today I'm going to be talking about the relationship between climate change and plague epidemics in the medieval period. In particular, I would like to focus on how previous research has investigated this relationship, and from there look at how we can model future research in a more interdisciplinary way. I will present the evidence for climatic change around the first and second pandemics, especially the initial outbreaks of these pandemics. I will then go over the genomic evidence of Yersinia pestis, the bacillus that causes bubonic plague, and why it is important to climate plague research to develop a phylogeny of the bacillus as a way of simulating the spread and evolution of a disease. Diving further, we'll take a look at one avenue that climate plague research has taken, the impact of climate change on rodent host populations, before then turning to how climate change impacts human populations. Finally, I will discuss what climate plague research should be investigating moving forward. First, let's take a look at the climate timeline. This first graph is from a 2010 study by Frédéric Charpentier-Lundqvist et al., which represents estimations of extratropical northern hemisphere decadal mean temperatures from 1 AD to 1999, within two standard deviations, represented by the gray shading here. This graph is based off of a multi-proxy synthesis. The green boxes are my addition to highlight the downturns representing the 536 CE dust veil event, the result of a series of volcanic eruptions and a minimum solar irradiance, and the period leading up to and including the initial 1348 CE Black Death outbreak. This graph is from another study by Lundqvist that looked at building activity and hydroclimatic conditions during the later medieval period. He and his team didn't find a clear relationship between the two, but this graph is interesting because it compares the grain prices, summer temperatures, and hydroclimatic conditions in Northern Europe during this time. See these spikes here and here. The green box again highlights the periods around the initial outbreak of the Black Death. This graph is from Bunting et al. 2016, which represents Eurasian summer temperature variability based on tree rings from the Russian Altai and European Alps, as well as on ice core-derived volcanic and total solar irradiance, seen at the bottom here. The tree rings allow us to build a timeline of climatic events, particularly cold periods and periods of increased or decreased rainfall, while the ice core evidence from Greenland and the Antarctic allow us to pinpoint dates of volcanic eruptions through sulfuric acid levels. There have been attempts to also track CO2 levels to determine human demographic impacts on agricultural cultivation and rewilding, but it has been somewhat inconclusive, and further investigation is needed into how significant an impact on CO2 levels could be made by pre-industrial land use patterns. What we can see in these graphs is a climatic downturn preceding the 540 CE Justinianic plague, and a more gradual downturn leading up to the 1348 Black Death outbreak. With these downturns comes increased rainfall and decreased temperatures across the year, but particularly in summer, impacting crop growth and leading to famine and socioeconomic depressions. Now, the first downturn began with the 536 CE dust veil event, which itself began what is now recognized as the Late Antique Little Ice Age, or Walia, whereas the second downturn began in the latter half of the 13th century, a little over 80 years before the onset of the Black Death. What is interesting is that two different studies, one by Mordecai et al. In 2019 and one by Thun and Svava in 2018, found that in the decades leading up to the Black Death in the 14th century, there was a process of rewilding and abandonment of land previously used for cultivation in Northern Europe. Thun and Svava specifically found evidence that pointed towards a demographic crisis in Norway that predated the Black Death by several decades, suggesting a series of disastrous climate events that led to crop failures and famine. There has been no such evidence for a similar process occurring to the initial outbreak of Justinianic plague in 540 CE, but further research still needs to be conducted. This may be due to the fact that the climatic downturn that began in late Antique Little Ice Age happened too quickly for such an impact that we see prior to the Black Death to be detected archaeologically. Now that we have an idea of the climatic context, let's look a little closer at the plague outbreaks. A particularly popular and rewarding field of research in the past decade has been into the genomic evidence of plague in archaeological contexts, which has helped to develop a phylogeny of the Yersinia pestis bacillus strains. Genomic testing has been essential for confirming historical records, and when documentary is not available, especially pertinent for the first pandemic, the unwitnessed extent of the plague. It is through genomic testing that Justinianic plague has been identified in Bavaria and England, seen here by the yellow squares. Areas without documentary evidence of plague outbreaks during the 6th century, or in the case of England, no documentary evidence until much later in the 7th century. Developing a phylogeny of the bacillus has also been crucial to understanding the disease itself, specifically how it emerged, died out, adapted, and spread over time. For example, research has found that the strains of Yersinia pestis found in 6th and 7th century remains are distinct from strains found later in the 2nd and later 3rd pandemic, 1855 to 1959. Suggesting that the strain responsible for the Justinianic plague became extinct after the first pandemic, i.e. sometime after the mid-8th century. The strain responsible for later outbreaks during the second pandemic, therefore, is a result of a separate emergence of the bacillus in rodent and later human populations. Sampling from various sites across Europe and China has found evidence to support the theory that during the course of the second pandemic, the plague cycled through the Mediterranean and northwestern Europe, before a new outbreak brought it into Russia and back into China. By tracking the evolution of the bacillus, we can understand the plague's movement through the human population and how it adapted over time, and thus begin to puzzle out what it is about the plague that allowed for an evolution that caused such devastating pandemics. Previous research has focused on the role climate has had on rodent populations and the spread of Yersinia pestis. While pneumonic plague can be spread as a respiratory infection through aerosol droplets, bubonic plague is specifically the result of lymphatic infection from a bite of an ectoparasite containing the plague bacillus, which is why fleas and their associated hosts have been so crucial to plague research. Black rats have been the focus of a great deal of plague research due to their proclivity as amplifying hosts of the Yersinia pestis bacillus, and yet they are incredibly difficult to find in archaeological contexts. Some argue that their absence is a result of excavation bias. Others argue that the absence of black rats is rather proof that they were not hosts, and that there must be some other host vector responsible for the disease outbreaks. The black rat, despite its popularity in plague research, is not the only rodent that can host a plague reservoir. Populations of long-tailed ground squirrels and all-time marmots are known to be modern plague reservoirs, and camels have been found to be easily infected by Yersinia pestis and can transmit via flea to humans. Timothy Newfield explored how climate changes can disrupt plague reservoirs in wild rodent populations, resulting in the bacillus overflowing into commensal rodent populations as the sylvatic host populations either outgrew their normal habitat or suffered significant population loss, and thus caused an imbalance between predator and prey populations. Boris Schmidt et al., however, found no evidence to support the theory of a climate-sensitive plague reservoir in wildlife rodent populations in medieval Europe, despite the positive correlation found in Kazakhstan Great Gerbil, and flea population densities in climatic conditions. On the other hand, Maria Sparou et al. Found that through the development of Yersinia pestis phylogeny, there is at least genomic support of the European reservoir of the bacillus. Finding evidence of a wildlife animal reservoir of the bacillus is important, as mathematical modeling of plague persistence patterns suggests that large populations of rats and other rodents can harbor the bacillus for a period of 10 years before the infection spills over into human populations and can cycle in this way for a century. Expanding research into archaeological evidence for rodents other than the black rat in sites associated with plague outbreaks could help further our understanding of how plague was transmitted, especially in areas where black rats are not commonly found. Hoofdhammer and Wallow, however, have argued that an insect ectoparasite vector without a mammalian vector must be responsible for the transmission of the disease, and that the human flea and louse could have aided in transmission, as they can survive without feeding in cloth, wool, bedding, and other transportable goods. The concept of a non-mammalian ectoparasite vector may be a better argument than simple excavation bias. The trouble is proving the archaeological presence of infected human fleas and lice. Unless one or the other is trapped in amber in situ, the theory remains speculative. When looking at the osteological evidence, it is imperative to point out that there is no way of detecting plague in the skeleton without ancient DNA. So that when examining the skeletal data, what we are looking for is not plague, but evidence of stress that could make an individual or community more susceptible to a plague outbreak. I am in this case referring to evidence of nutritional stress, growth disruption, and demographic changes as seen in the skeletal record. Since malnutrition and diet are inherently tied into the environment, evidence of changes in diet and nutritional health can allow us to examine how periods of climatic change affected community health over long periods of time. It is therefore unfortunate that osteological research into this topic has not been as forthcoming or pursued as other avenues, such as genomic and climate research. Crop failures caused by climatic events would directly impact nutritional health as a community experiences famine. Traditional stress markers, such as linear enamel hypoplasia, noted here by the black arrow, cribo-orbitalia, seen as the pitting in the orbits here, and parodic hyperostosis, seen here and the thin pinpoints on the cortical bone here of the skull, would reflect nutritional and metabolic stress and would be expected to be found in individuals who survived periods of starvation, febrile conditions, and metabolic stress, such as nutritional deficiencies like anemia. Childhood nutritional stress can also result in growth disruption, most often seen in shortened stature, although a recent study by Sophie Newman and Rebecca Gowland has found it can also affect neural arch growth. Undernourishment in childhood can also result in compromised immune response and inheritable metabolic defects, and may be reflected in increased frequency of traditional stress markers. Another component to consider is maternal health, as this can not only affect maternal mortality rates, but also the health and mortality rates of the child. Thus, changes in demographics as a result of poor maternal health and poor immune response can be expected in a situation where there is prolonged nutritional stress. Finally, a 2020 study by Brittany Walter et al. Hypothesized that extreme nutritional stress can be detected in nitrogen isotope levels. This would be a useful stress indicator to further corroborate skeletal changes such as linear enamel hypoplasia. Antoine and Hilton began a study into evidence of stress markers in individuals who died during the Black Death approximately 30 years after the Great Famine, 1315-1317 CE, but the results were not published. Scott and Duncan briefly discussed the role that a compromised immune response as a result of malnutrition may have had on a population's mortality rates in the wake of a Black Death, but say little else in terms of the long-term impact dietary deficiencies have on a community or how this could have affected immune response prior to the Black Death. Scott and Hoppe found that in a late 13th and early 14th century Black Friar cemetery in Odense, Denmark, that there was no statistically significant evidence of increased stress between those before and after the turn of the 14th century, although there was a trend towards an increased level of manifestation and number of stress indicators present in those buried between 1300 and 1350 CE, i.e. the decades leading up to the second pandemic. I recommend taking a look at Bruce Campbell's 2016 book on the climatic impact on the second pandemic, as it is a thorough exploration of how climatic episodes affected regional environments in Western Europe, which in turn triggered a failure of wheat crops, the spread of sheep scab, which impacted wool production, and the rinderpest, cattle plague, and of course the outbreak of bubonic plague in human population. He also explores the social, political, and economic implications of these events in detail, which I unfortunately do not have the time to touch on here. The After the Plague Health and History in Medieval Cambridge project at the University of Cambridge is another example of how building a paleoepidemiological profile of a community can allow for a deeper and more nuanced understanding of the short and long-term effects, both biological and social, of plague outbreaks. Needless to say, more research like Campbell's and that of the After the Plague project needs to be conducted, which brings us to my last slide. In this presentation, I have covered how archaeological research has pursued the climate plague question through climatic and environmental data, the development of a Yersinia pestis phylogeny, the exploration of the mammalian host variable, and the osteological evidence of stress. However, there is more work to be done, especially with the current situation with COVID-19. There have been a couple papers in the past couple years alone that have investigated how climate change has impacted the spread of diseases such as plague and the H1N1 virus, with a general consensus that we should not be looking for a direct causation between the two, i.e. climate change causes pandemics, but rather how one drives the other, i.e. climate changes lead to conditions that make communities more susceptible to disease epidemics. Therefore, future research needs to focus on three things. One, the interdynamic impact of environment by further investigating the climatic impact on mammal host populations, land cultivation, and diet in order to understand how climatic and environmental conditions impact and interact with human populations. Two, the viability and evidence for various host populations of Yersinia pestis today, so that we can further investigate the evidence for these host populations in the archaeological record. And three, creating paleoepidemiological profiles of communities through cemetery populations to track changes in health and diet as affected by climate change in order to determine the long-term effects. Future research, therefore, needs to look not at one piece of evidence over another, or one specific methodology or discipline, but rather how these various pieces of evidence and vectors interact with each other. Only then can we fully appreciate and understand the climate plague, and indeed climate disease question, and through that develop a model to help us plan for the future. Thank you.